Hi, I am Becky Meagher, and welcome to Transitions, Body, Mind, Spirit. We all go through so many transitions in our life, from, one career to another career to maybe children or not. And I like to use the metaphor of triathlons, something I did 4 sprint triathlons this summer. And in a triathlon, the first thing you do is swim. All right, then you go into transition area, and the next thing you do is bike, and then you're in the transition area again, and then you finish that, and ta-da, you're finished. All right, well, I love the idea of transitions and finding out how do people deal with so many different things. And so we have a wonderful guest today, Katina Beard, who is CEO of the Matthew Walker are we saying Comprehensive Center?
Comprehensive Health Center. Matthew Walker Comprehensive Health Center.
Comprehensive Health Center. And she is in my breakfast club, and she could do stand-up. She's very comedic, but she is also a powerhouse woman, and we're going to find out more about what she does and her whole background and what made her what she is today. So, Katina, welcome.
Thank you, Becky. I'm so glad to be here.
Yeah.
Thank you for the invitation.
Yes. All right. So give us the short and sweet of what is the center.
Sure. Matthew Walker Comprehensive Health Center is a federally qualified health center, the first founded in Tennessee. And the federally qualified simply means that we receive a portion of our funding from the federal government. Our comprehensiveness comes from the depth and breadth of our services. And so we provide medical services, primary care services, oral health services, so we have a dental program, behavioral health services, so we have trained clinical psychologists and licensed social worker, mental health. We have an on-site pharmacy, a radiology center that includes plain film radiology and mammogram.
Wow.
We have a social services program manager, we have case managers and referral clerks, and just a ton of programs and services that wrap around the patient. We see patients from the womb, so we see pregnant women, we see their babies, we see older adults, and so the full family can come to our health center. And so as a comprehensive health center, we are very interested and committed to providing timely, affordable health care. Our target population is the uninsured of Nashville, those who don't have any regular health insurance benefits. However, anyone with health insurance or not are eligible to use our services. So in a nutshell, that's who we are.
Okay, wow. So, and to even expand that, it's in what part of Nashville, but you have satellite places too.
So our main site, the Nashville location, is at the corner of 14th and Jefferson. So our address is 1035 14th Avenue North. Our second location is in Clarksville at 230 Dover Road. Our third location is in Smyrna at 739 President Place. We have a mobile unit, Howie, Healthcare on Wheels for everyone, and we have a school-based clinic at Pearl Cone Magnet High School.
Okay, the school-based clinic, does that mean non-students can go, or is that just for students?
It's just for students, and so we have primary care, and our behavioral health person is there, and we are thinking about adding dental at some point. And so we're there to make it easier for the kids, the students, to stay in school. And so if they are not feeling well, they just need to see a provider, or we're their regular primary care provider and they need to see someone, it just makes it easier for them to have access. So we want to teach our kids early the importance of prioritizing their health, right? Don't be sick at school and then just go home and try to deal with it or wait until something else happens. You have access to a provider right there at school.
So if somebody in school is sick, they can go, well, in Pearl Cone anyway, they can go right there and say, I feel like my throat, strep throat or what have you. And how much will it cost them?
So our clinic fees for Pearl-Cone, or all of our fees are based on the household income. So we have a sliding fee program that just is based on your household income and the number of people that live in your home. But most of our Pearl-Cone kids have insurance of some type. So, yeah.
Okay.
Yeah.
Wow. Interesting. And then didn't you say you had interns?
So we train through, so I want to take you back to our founder, Dr. Matthew Walker Sr., who was a surgeon at Meagher when he founded the health center. And so he would travel to Mound Bayou, Mississippi to help train other medical students, residents at the time in Mississippi, because they could not be trained in hospitals during that time because of segregation in Mississippi. So he would travel there. He would take time out of his schedule to go and travel to Mississippi and help train. It was there that he saw the first community health center being formed in his community, which was in Mound Bayou, Mississippi. So he brought that model here to Nashville. He wrote a letter to the then president asking for some money to start this program, and so they sent him a check with a handwritten letter and told him to do his best. And so I think we still have that letter in the health center in our offices. And so Dr. Walker was very committed to providing health care in the community for people, by people who looked like the community. And so he understood culturally sensitive healthcare then, right? It's a big thing now, right? Making sure that communities have diverse healthcare leaders, that the doctor that they go to looks like them, so that it's, you know, a better relationship, is an easier conversation. You know, you buy into it, right? If you want to talk to someone about being in a triathlon, you want to talk to somebody that's been in a triathlon, right? And so he understood culturally diverse and culturally sensitive care in the 1960s. And so he planted the first health center in Nashville. The first health center was actually off of Jefferson Street, right above where the NAACP office is now. And then it moved to its second location at 1501 Herman Street, which is where I started. And then we moved to the 1035 location. But he was a big proponent of training students. And so we still carry that legacy today. And so we train probably about 300 students across all of our sites annually. And
300
some of them,
a year?
About 300 a year.
Whoa, that
and
is big.
So they are terminal students. They could be, you know, physicians or dentists, pharmacy students, nursing students.
Wow.
And so we train them, you know, they can stay with us a week, 2 weeks, months, years. So those that stay with us a year, we have a program, a partnership with the University of Tennessee in Ascension to fund our dental residency program. And so right now we're training 6 dentists in the community health center model. And so giving them exposure to treating people in a community-based nonprofit dental practice, because a lot of dentists, as physicians do, want to go off and start their private practice maybe because they don't know anything about community health. And so a lot of them have a calling to serve the community. And so we are playing our part in training our future dentists. We also have a program with Vanderbilt that we train nurse practitioners. So we have a nurse practitioner residency program. And so they are also trained in working and serving in the community. And so when people think, you know, oh, they are learning to treat poor people. No, they're learning to treat people who may have different barriers or challenges, and helping to keep a community that is poorly resourced healthy. And so that is how we envision the work that we do. It's not that we are treating these poor people, but that we are treating people who just may lack resources and need the same, deserve really, right? The same quality of care that you and I get because we have an insurance card. And so having those techniques, having those opportunities to be trained, to learn in this environment is very different than being trained and learning in a for-profit or a more corporate setting. So
Right, and they are guided by their heart to help people.
Absolutely.
And then you have not, you just talked about population. Are we talking African American population, Hispanic population? What population is how do you break that down?
Sure. So just about 45% of our patient population are African American, and then it's spread across all of the other races and ethnicities. And you will see highs and lows depending on what community our clinic is in, right? And so Nashville is very multi-ethnic, and so we have a balance of African Americans, non-African Americans, Latino, using our services in Nashville, whereas our Smyrna clinic is mostly non-English speaking, maybe not just Latino, but Egyptian or African or Asian populations in our Smyrna clinic. And in our Clarksville clinic, I think it's mostly Caucasian because of the base and because of the demographics of Clarksville. And so it really depends on where the clinic is located, will depend on what that patient population is.
Wow. Wow. So how many employees do you have?
We have about 136 employees. I pause because it always changes. So I'm not, last I looked, it was 136 employees.
Okay. So I want to now go to, here is you, Katina Beard, CEO of 130 people. And all these different moving parts is just amazing to me. But let's go back to how this all even started. You were raised in Chicago.
I was.
Right, a northern gal.
Yes.
And you were the youngest of 8.
Yes.
8. So what effect did that have on you and your personality?
Yeah, you asked me about this. You asked me if that made me spunky, and people do, once they realize that I am the youngest of 8, they go, oh, that's why you're so bossy. And so I don't know if that's necessarily true. I don't know if that's where I got it from, because I didn't grow up in a house with 7 other siblings. We are from a blended family, and so I grew up in the house with one sister who has an intellectual disability, and my parents were older, and so naturally, right, they had to take care of her and spend time with her and manage her. And so I kind of was left to my own devices, right? And so I think that helped me to be more independent. You know, I grew up in the 80s. I came of age in the 80s and the 90s in Chicago. And, you know, I went to high school with friends that knew how to ride the bus, and so we would ditch class a little bit and catch the bus and go downtown and, you know, get back to class. But I was also in the band. I played clarinet, and, you know, I was in a program. I remember being in a program in high school called Principal Scholars, and it allowed me to go to Champaign-Urbana, the campus at Champaign-Urbana. I had no idea what that was or why I was there, but I knew that I wanted to go to a college. Like, I just was like, oh, this is where I'm supposed to be. You know, I'm supposed to go to college. And so all of my friends were planning to go off to college. My best girlfriend went to Xavier University in New Orleans, and just everybody was going away. And so I wanted to go. And my mom was so, like, she could not figure out why I just wouldn't go to school downtown Chicago. And I was like, because all of my friends are leaving and I want to go. And so, sight unseen, because this is much more before we had the World Wide Web, you know, the internet. And so who could go online and see anything? And so I remember my dad and my brother packing me up and driving to Tennessee. We had no idea where we were going. And I laugh every time I drive past the TSU Avon Williams campus, because we thought that was it. And I was so disappointed. Like, I knew my daddy was not gonna let me stay if that was it. And so no, you know, we found the main campus, and I was like, this is it.
This is a real college campus.
It's a real college campus.
Yes.
And so
at Tennessee State University.
Tennessee State University.
There you go.
And so started there as a freshman in 1990. And had no idea what was
what was your
happening.
major?
I believe I started off as a business major. Then I probably moved to economics, and then I went to something else. I quickly figured out business was not mine. Finance was not my calling. It was not my calling. And somehow I was introduced to healthcare administration and planning under Dr. Richard Enix, who has since passed away, but was passionate about community health, passionate about the development of healthcare in the United States, talked about what now I understand to be the safety net. Did not understand it then, but now I understand what he was teaching was about the safety net, which is about all the programs that were created to take care of poor people and making sure people had access to health care. And so, you know, during that time, you know, you only think, well, I'll go work at a hospital or I'll go work at the health department. And so I did a brief internship at the Tennessee Hospital Association in Dallas, Texas. I stayed at the Tennessee Women's Christian University in a dorm room. That was exciting. Had never been. Again, my parents could not understand, why are you going to Texas? What are you doing? But I went. And so I think being the youngest of 8, back to your question, gave me a sense of adventure.
Okay, I want to do this, and I've never done it.
I'm just going to do it. Yeah, I'm just going to do it. And
wow.
So I did all these things, and so I worked there at the Texas Hospital Association. I came back. I did about a year, maybe 2 years, the Veterans Administration and Ambulatory Care Department, which is all the outpatient clinics. So massive operation, and learned a lot about outpatient care and appointments and telephone systems and Joint Commission accreditation and quality assurance. And so all these things that I had no idea why I was learning them.
Okay, wasn't there some IT stuff involved?
Well, that was, I haven't gotten there yet, Becky.
Oh, okay.
Haven't gotten there. You want to hear about my transitions?
I do.
So I left the VA, went, I think back to school, I think I was still at TSU at the time. But anyway, graduated from TSU, got a job, and that particular job didn't work out. And so I went to a temp agency that sent me to Matthew Walker. And so I went to Matthew Walker as a temp, working in the CEO's office, typing documents. That's what my job was. Typing documents, because everything was handwritten and they wanted it all typed. And so I was typing, but then quickly, you know, organizing things and, you know, just really growing in my administrative skill, which I then figured out, this is what I like to do. I like to, you know, I'm good at this. And so I went back to school. I went to Meagher and earned my master's in public health from there. And that's when I went back to Matthew Walker as the IT person.
Oh, after you got your master's.
After I got my master's, I went back under the guise of and leadership of Michelle B. Morris, who was the CEO at the time, the visionary for the organization, the health center as it stands now at 14th and Jefferson Street. And so, yeah, I was the person that, when your phone broke, called Katina. We need new computers, and so Katina
impressive. A woman.
Get under the desk and pull all those wires and do all those things. And I worked, you know, on vendor management around contracts and ordering equipment and all of these things. And so that's how I started my career at Matthew Walker. And so did that for about a year, and I remember Ms. Morris asking, at the time, the all-male senior level staff about me and adding me to the senior leadership team, and they all voted yes. We think she would be a great addition.
You were the first woman on the leadership
team? Well, under
team?
the CEO, yes.
Okay.
I was.
Wow.
And so,
that was
yeah, at 27 years old, I think, to be on a senior leadership team, it was amazing. It was amazing.
Yeah.
Yeah.
27, that's pretty, they really had confidence in you.
They did.
Yeah, they saw something that you're like,
that
okay.
I did not see in myself at the time. And
You're
so
right.
could not see. And so I've just been progressing and moving since then. So.
Okay. All right. Now, part of this big progressing thing was they said we want to build a new center, build it from scratch, right?
So in 1998, if you all remember, there was a tornado that came through North Nashville in 1998.
Right.
And it damaged the 1501 Herman Street building, which was already, right at the time, it's 1998, so it's a 30-something-year-old building already. And there were problems with, there was a basement, so there was problem with flooding, and so water would come into the building and all this. But so Ms. Morris arrived at this building as a CEO, and there were no lights. There was no HVAC because the tornado had damaged the building, and it was hot. And I remember us having clinic outside, and it felt like MASH, if you remember. Like
Oh yeah, the TV show.
Felt like MASH. And some of those providers that were there then are with us now, and we laugh about it, and we're like, can you believe that we did that and that we made it through that summer? And we did. We made it through that summer. The building got the repairs it needed. We were able to go back in. But she set her mind to build a new building, a new facility for Matthew Walker. She wanted North Nashville to have a health center that was a beacon of light. And so I remember her saying to me, I want the because it was a 1968 building. It was, 80% concrete, those little skinny rock windows that you really couldn't see in or out of. It just kind of let some light in. 1,000 doors, 1,001 hallways, and so she wanted something modern. She wanted something that brought light in. She wanted something that North Nashville could be proud of.
And so she said that you were going to be in charge
of being the project manager liaison between the staff and the architect and the contractor.
That is a giant job.
It was very much a giant job.
And so I find it amazing that okay, all right, now you do all this, and you really never built a building.
Oh, no.
And didn't you say emotionally there were times that you just cry?
Oh, I went before my church and asked for prayer, and I cried. I was in Sunday school class, and I cried, and I just cried and cried because I could not believe that I had been given this monumental task to do, and so I remember reading books and, taking project management classes and just doing all these things. But at the end of the day, it really, and I look back and I know that I had to lean on my faith, and I had to really trust God to bring me through and to give me the knowledge and the wisdom and the understanding and the people and the right timing and the right information to do the best that I could do, right? And so because I didn't know. And I remember being the one to have to tell the staff, no, we're not gonna have an ice machine. I don't know why you want an ice machine. And so I was at the time I had to have been 29.
Wow.
Yeah, 29. And so you talk about spunky and much attitude. Did not mind saying, no, we're not going to have an ice machine. No, we're not doing. And people were just angry and but listen, this is what we're doing. This is what we're doing.
Well, I want to make sure that we go on to the next level, which you did all this, and then you were asked to be the CEO.
I was. And so this was many, many years later, 2 babies and a marriage later.
Well,
I know you want to talk about that. I know
you got married. You're doing all this, and you're having babies, and you got a husband.
Married and having babies and
doing this monumental task.
Yeah.
And going, it's nothing.
Yeah, I tell everybody I marked the babies by the buildings. And so I was pregnant with Michaela when we built the 1035 building, because I remember sitting in a place looking at some furniture. I don't even know why I don't know. It was furniture all up around me, chairs stacked everywhere. And I just remember sitting there going, Jesus, please don't let these chairs fall on me and the baby. Why am I in here? And then our Clarksville site, I was pregnant with Kendall. And they actually opened, I think, while I was out on maternity leave with him. And so I didn't even get to go and do like a punch list or anything. I wasn't the project manager for that project. We had another manager, but I wrote the grant that funded the project. And so it's still a baby.
I know you did grants, and then we only have so much time. I want people to know about your 2 kids, where they are. You obviously, your husband had a lot to do with it, that you've been married to him.
A little bit. He contributed to it.
But your kids today are how old? And they're doing today. What? Your daughter is 22?
No, she's 20. Don't rush it, Becky. Don't rush it. She's 20. She just turned 20. She's a junior in college at North Carolina A&T State University in Greensboro, North Carolina. She's a computer and electrical engineering major with a minor in math. And Kendall is 16, an anxious driver, waiting for November to turn so he can go and get his driver's license. But he is a certified lifeguard, has been a lifeguard for 2 years now, serving at Boxwell. He is a member of FFA, competing in state and national competitions around FFA issues, agricultural issues, and he is
well-rounded,
budding and future animal science major. He wants to be a vet, and he is a Boy Scout who is going to start his Eagle Scout project. And very soon, Michaela was a Gold Award Girl Scout, and he will be an Eagle Scout in probably less than a year. And so they keep me busy. And Mr. Beard, for those who are wondering if I'm related to the West Tennessee Beards, I am not. I am related to the Michigan Beards, and he is the only Michigan Beard they got out because they're all still in Detroit, Michigan. And so we have been married now. It will be 22 years on the 21st.
Wow. I find it amazing, this incredible career, and a husband of 22 years, and having these amazing kids that are obviously, they look at mom and dad and say, hey, we can do this, we can, and Eagle Scout, and you're in a choir.
I am.
Too?
I go to Lake Providence Missionary Baptist Church, and I sing tenor. No, I'm not going to sing a song for you. I'm not. Don't ask. I'm not. And so, yeah, I'm a Girl Scout leader for Troop 539 under Service Unit 051. I've been a Girl Scout leader now for 11 or 12 years. I started when Michaela was in the 4th grade, and so I had junior Girl Scouts until last year, and then I took over the senior girls, and so all high schoolers, so I get to learn new words and things that they shouldn't be saying.
Keeps you young.
I guess, or it's aging me. I'm not sure which one. And so, yeah, and then I'm a Boy Scout mom, and I have to mention Scotch Cooper, who is our Australian Shepherd dog, because if Kendall's watching, he'll say, you didn't talk about Scotch. And so we have a dog. His name is Scotch Cooper.
And a dog, too.
Yeah. Well, I don't have a dog. Kendall has a dog.
Kendall, your son has the dog.
He has a dog. Yes.
Wow. Well, it's so amazing to me that your children have mirrored you just by, well, you taught them, but they have mirrored you because of your organizational skills. And for them to be accomplishing so much, you know, a daughter, electrical engineer, wow. They've been mirroring, you know, mom and dad do this, and well, I'll do that too.
Yeah, yeah.
And the healthcare business is amazing, and I learned that you don't have to be poor to go there if you have insurance.
You can.
And you are certainly welcome, and there's a lot of different areas, from dental to medical. I mean, look at all the areas.
Yeah.
So people can just call up, get an appointment, and take care of that.
Yeah.
Yeah.
They can call 615-327-9400 and get an appointment at any of the sites.
There you go.
Yep.
Wow. And I think it's amazing that you're still singing and doing the church thing.
I am.
And the Girl Scout thing.
I am.
And I do have to mention that in another life, she was a stand-up comedian because she is so funny at our Women's Breakfast Club.
We have to give the National Women's Breakfast Club a shout out, Becky. We gotta give our fellow breakfast clubbers a shout out.
Yes.
So.
Well, Katina Beard, thank you so much this has been fun.
Yes.
And there it is, Transitions. Have a good evening, good morning. Thank you. All right.
Yay. That went fast.
I knew it would.